So hi there, my name's Phil Minns. I'm an HMI and I'm also Ofsted Specialist Advisor for Early Years and Primary. I work in the policy team, but I also do inspection work at the same time. So I'm going to talk to you for about 10 minutes and give you a little bit of an update on where we are, and also go on to some stuff that you'll know already, but just some reminders and to follow on some of those things that Ada was saying about assessment and tracking. And perhaps just to follow on from what Ada said there, actually, we won't look at your tracking. It's very clear in our new handbook that we will not sit down and look at tracking with you. What we're interested in is what you know about your children, what they can do and how well you know them. So that's the conversation that we'll be interested in. But let me move through my slides, if I can. There we go. So just a little bit of an overview of where we are at the moment, our current plans. We've suspended routine inspections, you'll be aware of that. We're currently carrying out a mixture of other things. So we're doing interim visits into schools and other places, finding out about how things are going. We're doing childcare registered inspections to make sure that those things are okay. And we're also carrying out a series of phone calls as part of an EY research project that we're doing, which fits into and contributes to the overall big picture that we're getting of how providers right across the board are coping with the challenges that they're facing with COVID. As you can imagine, we're thinking carefully about what's going to happen next, and how and when we will return to routine inspection. A decision hasn't been made yet. We're in discussions with the DfE at the moment, and we'll let everyone know as soon as we can. So what I thought would be useful, apart from a couple of messages that I'll go on to, just sort of reminders, I think it might be useful just to know a little bit about the research that we're doing and some sort of early findings from that. So we are deliberately doing this as a phone call rather than a visit, because we know the pressure that people are under, and we've been really pleased by the uptake. This has been a sort of voluntary thing, so we have gone out and found people who are willing to talk to us and then have spent time speaking to them on the phone. We've been asking about children's wellbeing and safety. We've been finding out about changes that they've had to make to the curriculum, how their teaching might have changed. And we've also found out a little bit about plans for the future. And we've been rolling this up into a series of commentaries that Amanda Spielman, our Chief Inspector, has been publishing. And we did the most recent one a couple of weeks ago, and I think the next one we'll be heading towards is December. And we've been finding out some really, really useful information. And also, perhaps it's worth saying at the beginning that what we've also found out that everyone we've been speaking to cares deeply about the children that they're working with. Everyone is going above and beyond. And in the enormous efforts that people are going to is really humbling and impressive when we hear about those things from them. So you can see that this slide is just giving you a brief sort of overview of what we've been looking at. And the adjustments have been really interesting. We've learned quite a lot about how people have compensated for the things that they can't provide. We've also found out how some people have used the challenges as a bit of a challenge to themselves to get over some of I've got too many challenges there, but some of the things that were troubling them about some aspects of the curriculum. So it's been a really, really useful opportunity, and also it's worth saying as well that people have really responded well to being asked the questions. Many people have welcomed the opportunity to sort of reflect on what they've been through, what they've had to do, and the decisions they've had to make. So we found them to be really, really valuable for us, and I think for some of the people who've been involved. So I just thought I'd run through some of these key messages. And the COVID-19 series, that's the series of Her Majesty the Chief Inspector's commentaries that are published. If you wanted to have a look at these, you just have to Google Ofsted commentary COVID-19, and these things are from the early years report that we did. I'll be able to talk to you about a little bit more than that because I'm going through everything and sort of leading on the research, so I can just add in a few more things that might perhaps not be in the reports. The first thing there, I really liked this phrase that one of the people we spoke to used about children being understandably disorientated. And I think it's really useful, and with the theme of this event today, it's really useful to remember that for some children, in fact, let's hope for most children, this is a phase that they've been through that they will be able to get over. and they should be able to get back to normal. We know it's not going to be the same for everybody, but for most, and that is sometimes helpful. So the particular person that we were speaking to when they said this understandably disoriented, they said, well, they've forgotten quite a lot of stuff. They've been out of the setting for quite a long time, and we had to give them time to remember those things. It's one of the things that when we talk about curriculum, we say that good delivery of a curriculum recognizes that we need to remember stuff. When you first get in the car, I don't know if it's the same for you, but when I first got in the car after having not driven it for quite some time, because I was avoiding it for quite a long while, I knew what to do, but I did just have to remind myself slightly. Or, if people go back to something they used to do that they haven't done for a long time, if you used to play an instrument and you haven't played it for a long time, you have to have that time to remember. That's one of the things that some of these people were saying was, these children had forgotten how things operated in the setting. So we had some people who were saying these children have forgotten how to, use some of the equipment, how to use the potty or whatever it was that they had there. They said we just had to help them to remember, and then we could help them move on. So they weren't seeing it as a sort of, they'd forgotten entirely. It was just about helping them to remember. And also that a lot of people told us that the children were less confident with other children. A lot of them were saying, they were not as chatty with adults or other children, particularly as they had been before. That was something else that they had to get back used to. Everyone that we spoke to really were telling us that there was a greater focus on prime, and that is, a really important thing to remember at the moment. And we've got that in the DfE guidance, that there should be a greater focus on prime. Prime's called prime for a reason, isn't it? It's because it is so significant and so important. And that is a very good place to start. And we found that most people have been doing that. Interestingly, where people said, well, no, they haven't increased the focus on prime, it's often when you get into it, it's because they've got a really heavy focus on it to begin with. So actually, they've already got a lot of day-to-day stuff focusing on the prime areas of learning. And so they didn't feel the need to up that because it was already there. Lots of people have spoken to us about the impact on the activities that they provide. And we've got quite a lot of detail there about what people have had to get rid of or replace, or going for smaller activities because of trying to reduce some of the risks there. And it's been interesting there, and we've had some interesting conversations with people who said, it's made me think about why I do that. Why have I actually got the Play-Doh? Why do I rely so heavily on it? And now, there are ways that I can still provide it, but actually what it's made me think about is what the children learn from the Play-Doh, and therefore how do I need to do that? And for some people, they've said, actually, it's released me from some of the sort of tyranny of feeling that you've got to have all of this stuff out all of the time. Because I should say, well, actually, what do I want these children to learn? And what am I really focusing on now? And is the thing that they were previously learning from that bit of equipment something that I really need them to learn about now? Or can it wait? Because actually, we will get over this. We'll get back to normal at some stage. So, it's quite possible that the summer term, hopefully with a bit of luck, they'll be able to access that stuff. That fourth point there, we'll all know that some children are much more affected than others by this. And that again comes into some of that prioritization, I suppose, that we've been hearing about from people, where they say, well, she was finding this difficult beforehand, and now she's finding it really difficult. And we've really started to look more carefully at what she can do and what she can't do, how we're helping her, and actually if we need to go and find some help from somebody about this. So there's that real awareness that you've got that group of children. Perhaps many people have been telling us that there's a group where they think, yeah, with the right support, with us being there and all this stuff, they're going to get back to where they need to be. And then there's another group where people are a bit more worried, a bit more concerned, and they're starting to look to what they're going to do. And the last key message there, I think, that we've been hearing back is about those plans that people have got about maintaining high standards. And that seems to come through everything. They're always in the back of their mind. They've got, well, how am I going to get back to this? How am I going to make sure that these children aren't behind forever? There's that sort of worries that some people have that, we're going to have some sort of COVID-19 generation. And that where we found that everyone's worried about that, I think. But where we found people who are less worried about it is where they've got a clearer idea about what they think they need to provide for those children to make sure that they get what they need. So again, coming back to prioritization. And that's what I'm sort of just going to do a couple of slides on now, which will be stuff that you will be familiar with already, but I just wanted to remind you really of it. And just to reflect back on those settings that we've talked to and the people that we've spoken to who are not as anxious about it because they've sort of really clarified for themselves what they're prioritizing. And again, I said it before, we've got the prime areas of learning clearly. That recognition that children come to us with a wide variety in their exposure to vocabulary, and how fundamental that is, and how that remains the biggest single indicator of a child's long-term success in education. You know, that just simply the knowledge that they hold and the vocabulary they use is a really, I think, is a sort of pertinent reminder at this time that when we're prioritizing that quality interaction with children, the talk, the making sure that we're having those engaging conversations, that we're stretching the words that they use, and we can bring new words to them, and we can constantly be building that vocabulary and check that they understand that and then carry on. That is fundamental, enormous, hugely important. It's prime, and it's going to be the thing that makes the biggest difference. You know, there's that research that you'll be familiar with. I won't go into now, but you know that where a child's vocabulary at 4 or 5 not only indicates their likely success when they're in year 6 and their SATs, but actually whether, you know, also their likelihood of being unemployed by the time they're 36. It's really, really significant. And so that, and one of the reasons why we have that drive against some of the sort of overburdensome assessment is because what that takes away from is those meaningful interactions with children, which we know are actually, you know, what children really need and what they benefit from most. Second slide here, just to remind you of stuff you already know, is that importance of the danger of missing language, missing knowledge later on. And you know, there's some stuff that we do with our youngest children about, you know, the fundamentals of how to get on with people, of working alongside people, of some of the big physical skills and development that they need, some of their maths knowledge. These are pieces of information which they need to get when they're young. You know, that's what the early years does best, is teaching some of these really big concepts. It's the right place for children to get them. We need to make sure they get them, and we need to get those priorities in place, because unfortunately the rest of the education system aren't as good at picking them up, identifying them and dealing with them. You know, that's really classic quality early years provision. And the last thing, which goes back to those points that Ada was making, is about doing what's right for the children. And that comes back a big thing for us about assessment. We've had quite a lot of questions about assessment in the new EYFS. And our view, which is very clearly put down in our handbooks, is that we won't look at people's assessment and tracking. We are quite happy to have a conversation with you about what you know about your children, about what they've learned so far and what they're learning next. And in fact, the best conversations we have, I always think, on inspection is when we ask you about that child and you tell us about that child and you really know that child. That's what we want to hear. We want to hear from you that you know where they were, you know what they've learned so far, you know what they need to learn next, and you also know what you're trying to do about that. That's what we're interested in. You know, tracking systems and things that show that you've got a percentage of pupils who are likely to achieve or are going to achieve something. That's for you. If you want to do that, that's fine for you. But don't think that that's for Ofsted. We don't need that sort of information. We would always say that don't do anything for Ofsted. What we need you to do is do what's right for the children. And when we come in, we will be really interested in that. And that's sort of fundamental thing, I suppose, to remember. And there is also something else which I've said before, and I will say again, probably not just today, but as you know, forever and ever and ever. The most important thing, that, you know, the best thing for children is quality interactions with adults. And anything that takes children, well, takes adults away from those quality interactions has got to be really, really important. And so if you are doing tracking, if you've got sort of quite big tracking, you've got to really be deciding that that is having a huge impact on your children's learning, and at least as good an impact as what will simply happen from an adult having quality time with a child, because that's really where those children are going to make the most progress. So I think that's it. Thank you very much. I hope you enjoy the rest of the afternoon. I'm looking forward to it. And just that last message from us is do it for the children. Don't do it for us. Do it for the children.